Bolivia is a country of extremes, landlocked between the high Andes and the low interior Amazon. It is the poorest country in South America, a poverty that leaves many of the rural, outlying areas virtually forgotten. From the capital La Paz in the high Andean Altiplano, land native to the Quechua and Aymara people, descendants of the once great Inca, there is one road that leads north. Often no more than a truck wide, the road climbs over the last ridge of the Andes. These rock walls are the fortresses of the Amazon, and its glacial melt the food for the mighty rivers. Past potato fields and houses still built in Incan fashion, the road dips down into cloud forests, skirting along mountain edges. Half the year it is virtually inaccessible. The road makes its way down under the last range of the Andean foothills, looking east across the expanses of the Amazon basin. It enters the town of Rio Beni, a small outpost on the banks of the Beni River. My father arrived here in the autumn of 1996, weary after the arduous, bumpy 23-hour bus ride. He had stumbled into the maze of crowded and dusty, sunburnt streets, with no idea what he was about to find, or how the people of this beautiful, tropical landscape would change his life forever. He wrote when he arrived that sitting on the banks of the Rio Beni, as the sun sets over the distant Andes, one could easily drift into a world out of some Joseph Conrad novel in some past time in history. Rio Beni has an easygoing, slow-paced way of life that is typical for this tropical latitude and backwoods South American town, where siesta time is never missed, and no one complains about the mail coming in a couple of weeks late. My father had come on this journey after retiring from his 30-year medical practice in the hills of Central California. Inspired by a spirit of adventure, he had packed his bags and journals and set out for South America. To those that knew him best, it was not that surprising. He had always followed the callings of his heart, riding on a simple faith in life and the paths that we lead. It was his path that led him here, to the banks of the Rio Beni, where he fell in love with the beauty of the area and the vitality of the native peoples. He built a home along the river and began to fill his journals. But as time passed and as a doctor, he began to realize the difficulties of the people's lives, their poverty and complete lack of health care. The modern world had left behind this population to illnesses and health conditions that in most areas of the world are easily avoided. Infections, parasites, malnutrition. It was because of this that he decided to begin a small health project. He began the project with Antonio Mendia's guide, a small boat, 1 bag of medicines, and 7 communities along the river. Together they named it El Proyecto de Salud del Rio Beni, the Rio Beni Health Project. Soon more communities began to ask for assistance, and the project grew. Dr. Netzer wrote a letter to Christopher Brady, a longtime friend with 15 years' experience in international development. The letter arrived in Mozambique on the south coast of Africa where Chris was working. It read, "Help, I've created a health project." Chris teamed up with Direct Relief International, a non-government organization in California. For the past 55 years, Direct Relief has been providing medical supplies to indigenous health providers worldwide. Today, under the direction of Christopher Brady, the Rio Beni Health Project moves on with the grander vision of health education and prevention that will carry this project into the future. Since the Rio Beni Health Project began in 1997, it has grown rapidly, now covering an area of over 5,000 square miles, from the eastern slope of the Andes Mountains to the low interior Amazon. The staff travels along 150 miles of road and over 200 miles of river, providing medical attention to over 40 communities that lie along their route. There are 4 full-time staff members, and it is they who are now the heart of the project, who travel these difficult roads, It is their mission to provide medical attention and health education and training to the people of Bolivia's northwest jungles.